Hi, my name's Ray Peachey. I am the Town of Westford Substance Abuse Prevention Counselor. I work for the Westford Health Department. I have been doing that for 8 years. I am also a retired Westford police officer. This is our first of monthly shows that we're going to be putting on, and give you a little background on what will be coming up. And then we also have a guest here that I will introduce in this minute. During these months, we're going to talk about drug situations in town, locally, nationally, give you some stats, talk about emergency preparedness, food, how we go out and check out the locations, the restaurants, how you have to file complaints, what to look for. And camps, the day camps they have. People go out and they have things to do with that as well. We also can do, the public nurse will have come on and talk about a few things for us. And we also have the Upper Merrimack Valley Medical Reserve Corps, and we'll talk about that as well. Now we'll have different speakers. We'll have employees from the Westford Health Department and the Town of Westford. We will also have state and local people come in. Now what I'd like to do is introduce Jeff Stevens on my left. He is the director, the health director for the Westford Health Department. And Jeff?
Hey, thanks, Ray. So again, my name's Jeff Stevens. I am the director of the Westford Health Department, and I have worked for the town for approximately 3 years. I've been the director since about January 4th, when my predecessor Sandy Collins retired, and this town's been a fantastic town to work for. What I can tell you is a lot of people don't always know what the health department really does. We've got a lot of different facets that can be broken down into just a few things. I'll start with a very high level. We have 3 main categories of environmental, clinical, and emergency preparedness. In all 3 of those categories, we've got a lot of subcategories. For instance, in the clinical portions, where, Ray, your job falls into substance abuse prevention, where you do a lot of counseling and prevention work. That's a very emerging portion of our department, where we are now seeing real problems in even this town and surrounding towns, where opioid abuse has become something we need to really address and pay attention to, and let our parents and our kids know that there is help and there are things to do. And that's what you spend a lot of time with. That's a lot of your programming.
Correct, definitely.
Underneath that as well is we have our public health nurse, and Gail Johnson, our nurse, obviously does a lot of our clinical work. And what our public health nurse does is she's doing a lot of the prevention and surveillance on disease in town. She's also doing all of our flu clinic planning and ordering our vaccines to make sure we've got enough. And she's also making sure that reportable diseases get reported to the state. And she also does a little bit with rabies if there's ever a thing with an animal bite, or sometimes maybe a bat bite in somebody's house. We'll also address that. That's one portion of our clinical work. And I'm going to leave a lot of that to Gail when she comes in and talks about what she really does. The planning of the clinics and some of the other vaccines that she takes care of and wants to get out to the public, such as the shingles vaccine. She works to make sure that we have those, and she also makes sure that people can get them in a timely fashion. In fact, we're working on a potential shingles clinic at this point. I'm not sure when we're going to be able to offer it, but we're waiting for insurance companies to sign on to get the vaccine. So it's exciting stuff for us. It keeps us very busy in that aspect of the job. We love doing that portion of it. Another portion is the environmental, which could be our biggest portion of the job. Environmental covers all of your wells, all of your septics, all of your camps, all of your farms, all of your grocery stores, any place where you would typically do business. That's what we're looking at environmentally. If I start very top at the septic, the town of Westford is 100% dependent on septic in one way, shape, or form, whether it be a wastewater treatment plant or whether it be a personal septic system like most people have in their yards. Those systems do have a tendency to fail over time, and our department, which is headed by Seth LaJoy in the Environmental Services Division, spends a lot of his time making sure that everybody's septic is 100% compliant with our local reg and with the state regulations. And a lot of people ask why we're very particular about that. Well, Westford's also 100% dependent on groundwater. 75% of our wells are town water and 25% are private well. That's a lot. That's more than most other places in the state. So when we're starting to recharge back into groundwater, we take it very seriously on how that actually happens. So we want to make sure that when we are recharging our aquifers, we're doing it in a safe, dependable manner.
Definitely.
So it's pretty critical for us there in that aspect. Also in the environmental end, we're also paying attention to, on top of the wells, where your wells go, how deep they are, and what contaminants that you have in those. We spend a lot of time making sure that when you test your well, you're getting drinkable water, and if you're not, you need to know it, and you need to find out what you can do to make it safer to drink. Within that, we spend time talking to the water department about the town's public water supply, and we work hand in hand with those departments, so that's drinking water is a mission critical thing for that department as well as the health department, really important. We also pay attention to things like the barns, the farms, and a lot of the stables to make sure what they're doing is safe for the animals and safe for the environment. We want to make sure that whatever they're doing is going to maintain a safe level of protection for the general public. The next portion I'll point out would be our food protection program, which is headed up by Arnie Price. And anybody that knows Arnie knows he takes that job extraordinarily seriously and very passionately about how he does it. We give out over 275 permits a year. We do inspections on every single establishment in the town. We operate on a risk-based program, which means not every place gets the exact same amount of inspections. If you have a higher risk operation, you may be getting more inspections per year. We also have some of the manufacturing, such as our big dairy farm that we also work at, that everybody loves to go to. We make sure that that operation and its 5 kitchens are also safe and operable at all times. Within those inspections, they can take anywhere from 2 to 5 hours to do, depending on what they have to get done. They're pretty labor intensive, and they're all based off of the Food and Drug Association's retail program standards. And those standards are something the town has adopted to make sure that when we do an inspection, every portion of that restaurant is being paid attention to. It's not about just floors, walls, and ceilings. It's about time, it's about temperature. It's making sure that food is not kept too long in a cooler, that they're rotating their stock, that they're using safe products to clean the floors with, to make sure that people in the restaurants are actually working in a way that they understand that whatever they do could be a risk to cause a foodborne illness. Within that as well, we want to make sure that those people working in those restaurants understand that things they do at home can seriously cause a problem for everybody else. So impressing things like hand washing. That's a big portion of our environmental job that we do. Right. Within the summer camps, we have a fairly intensive program with the summer camps as well. The summer camps, we spend a lot of time making sure that they've got qualified staff, they're quarried, they're sorried, they have the right people doing the right jobs, they've got medical people on staff, they have emergency plans, they have backup plans for whatever they're going to do, and that they're following things like Christian's law for waterfront safety. So it's pretty critical there. Another portion of the environmental is paying attention to all of our public pools. We've got a few public pools in town and semi-public, and we spend a lot of time with our health agent, Ray Dick, going out to those pools to make sure that when you're in that pool, that water is safe to be in and not going to be murky, not able to see through it, not too strong, alkalinity-wise or acidity-wise, and make sure that when you go in,
You're
not,
safe.
you're safe and you're
Yeah,
not glowing when you
exactly,
get in and out.
Exactly. And on top of that, if I may, you talk about the doing the beaches. How often we do the beaches and
We actually test 14 beaches in town, and each one we test for E. coli, and we make sure that every time you go to a public beach that water is safe to be in, and there's a protocol that we follow. If there's a problem, we will go back and test it immediately, and if there's a problem after a second test, we'll then close the beach. Not our favorite thing to do on an 80-degree day in the summer, that's for sure. So, but that's one more thing we want to make sure we do, and that takes a significant amount of time. I mean, when you're driving 14 beaches throughout town,
Yeah.
that takes one person almost all day to get that done,
Yeah.
and then get it to a lab and get those results back. So those are some of those things that we do. The health department at a higher level is responsible for the surveillance of disease in town as well. So we do pay attention to how many people have the flu, how many people have a suspected tick-borne illness, how many people have something that's a co-infection, say is babesiosis or anaplasmosis. We pay attention to those things, and we'll run campaigns strictly to make sure that people understand what are their risks and what are they in danger of, and what can they prevent and control themselves. A classic case is when we get into the flu season, when we get into November, December, January, and we start seeing it hit throughout the country and in our region, we really want to push the hand washing with people to make sure that when you're out there, when you're leaving your house, when you're leaving a restroom, get your hands clean, scrub them down. It's the #1 best way to prevent yourself from getting sick.
no question.
Especially with things like norovirus and any of those viruses that fall along that platform. Keeping your hands clean, you can't do a much better job than that. That's one of the safest things that you can do. With the tick-borne diseases, obviously hand washing is not something you'd be paying attention to. However, checking yourself personally and your kids and your friends and your family, tick checks when you go out and you walk in fields, and we keep on our website a list of resources and guides on what you can do to reduce your exposure to some of the ticks that are out there. Some of the tick-borne diseases such as Powassan, which have not necessarily hit our region, and God willing they won't.
Right.
Particularly nasty style of tick bite that they actually will come after people as opposed to the other ones that wait for you to get to them. As long as we don't see that around here, that's great.
Yeah.
It has hit a portion of the Cape, so it's something we have to pay attention to. And there's not much we can do to necessarily stop it. But if you know how to protect yourself, there's a lot of things out there that if you just do basic things like checking yourself daily, washing your hands, paying attention to things in your own kitchen, if they smell bad, just giving yourself some tools to protect yourself is what public health really, really does.
And we will go into that when I would say Seth comes here possibly, or
And when Seth comes here, he can talk about that, or he can give you a rundown on what are the basics of your septic system and what does it take for that to run. What do you need to pay attention to, and what education do you need to make sure that you're using it properly.
right.
Those are all critical things. The same thing can happen with your water supply and when you're using your water. How much water is in your well, how big is it, and how fast does it take to recharge? Things that we can also talk about on this program.
Yeah, and most people don't realize, you know, unless you've sold or bought a house, what you have to go through to make sure that the septic is okay, make sure your well is okay. This is all the stuff that we're going to be able to bring out at a later time.
Yeah, and I think there'll be times where we can bring out new regulations and new bylaws that we're charged to enforce that we can discuss, such as the new one, the plastic bag
Yes.
bylaw that was a citizen petition that was charged to the health department to enforce, which is basically going to eliminate the single-use thin film plastic bags that all of us get at our grocery stores. I know a lot of people have arguments that say, well, they're useful, I can use them to pick up pet waste, and they're my second trash bag, and I think a lot of us agree with the fact that, yeah, they are good for those things. However, there's also a bigger picture that we sometimes need to look at, which I fully agree with, is that what is the environmental impact down the road? Where do these plastic bags that say you and I aren't using that get thrown away, blow into the trees, land in the storm drains, land in the waterways, and all of a sudden degrade over time and can do great damage to marine life,
Yes.
sometimes even to some of the great whales that get stuck with a plastic bag in their breathing holes and they get lost.
Yeah.
So it's little things like that, not to mention as the plastic breaks down, smaller fish may eat that. Those fish keep those chemicals within their body. Those fish now get put back onto the market for us to buy, and we re-ingest those chemicals again. So
Yeah.
there is a pretty long process that can take place. So these are things that we can control.
And we'll actually teach you another way of saying it, but and tell you how to avoid this stuff. There's no question. I mean, and then I know we're going to get into the opiate problem that we have. I mean, everybody has. Just for a point, last year in 2017, we've had a minimum of 6 overdoses, fatalities. And there are still some that are being analyzed by the medical examiner. But that's a jump from 2 from 2016 when we had 4. In 2016, we had 23 overdoses with 4 deaths. So it's just stuff like that we want to bring out, and so you people know what it's like to be in Westford. And we'll be doing this once a month. Different people coming in, organizations from outside, organizations from inside will also be doing this and coming out. I mean, the Upper Merrimack Valley Medical Reserve Corps.
Great group.
Yeah.
I happen to be the director of the Upper Merrimack Valley Medical Reserve Corps. Nancy Burns is our coordinator, and she does an absolutely incredible job with keeping a huge 520-person volunteer group at the ready to go for whatever the case may be. If it's an emergency where we have to evacuate people because, say, there was some sort of environmental disaster, or we need to run a mass vaccination with, say, a hepatitis A case, which hasn't happened very often in the state, and God willing doesn't happen again. We have the staff and the resources to do a mass prophylaxis of everybody in town. So they are an incredibly valuable group. They are good in disaster response. They are good in accident response. They have people that are medical, non-medical, clerical, mental health specialists that can respond at a disaster at the town's request and be those bodies that we need to get jobs done. It could be as simple as parking cars to taking blood pressures and triaging people if the incident was big enough.
Yeah, yeah. I know that they've been very good at that. They've done, they've helped out at different things we've had on the outside as well. They'll put up, do blood pressures for us, but some of them are nurses, and
They will run blood pressure clinics at any function that's in the area, and it's important to know that not only are they here in Westford and very strong in Westford, they do the entire Region 3C coalition, which is all the surrounding towns, and they will respond to those communities as well. A lot of our volunteers are from those communities and do come here.
Right.
And what they do for a lot of their training is going to some of the smaller events that happen, and they will set up and they will do their blood pressure clinics, and they will do their cholesterol screenings, and they'll do those activities to make sure that they're brushing up on their skills. And in fact, one of their bigger skill events is when we run our 7 flu clinics. We're in the process of getting ready to organize those dates, and we will heavily rely on the MRC for that. They are basically the backbone of that entire operation, and without them, we probably couldn't do those clinics.
And like you said, it's all volunteers.
They are, every single one of them. And yeah, they're a fantastic and amazing, dedicated group of people. I think it's also important to know that the health department answers to the Board of Health. There are actually 2 divisions, and we probably should have started with that, but never too late to get that in.
No.
The Board of Health is separate from the health department. The health department takes direction from the board. The board is the policy setters. the health department administers and delivers those policies, and whatever charge the board gives me. We meet once a month, usually the second Monday of the month, and we will have our meetings based on whatever the health need at that time is.
Yep.
The next meeting coming up, there's going to be a rather big presentation on the dangers of natural gas, and there's somebody that would like to come in and do that. So we're going to listen and hear what people's concern on using natural gas actually is as, say, an asthma trigger.
And I believe that's on cable TV as well.
That will be on this network as well.
Yeah, which is good, which is definitely good. I mean, so there's definitely going to be a lot a lot of information that we're trying to get out there. And also, you know, we'll take, if somebody has an idea that they want, they can call the health department if they'd like to hear something, and we can do that. And we'll see if it's feasible, and bring somebody in to talk about that and explain different things.
Yeah. I think it's important for people to know the health department plays a vital role in so many portions of people's lives.
Yes.
And from where you shop to where you sleep and where you go to work. So we pay attention to your air quality, your water quality, your noise pollution levels. And if we're doing our job really well, you almost don't know we're there, which is what you kind of want.
Yeah,
which makes us happy. So we can be reached at any time. If somebody has an issue, we can respond to it, and we can either help them solve that or tell them where they need to go to get that solved.
Yeah, exactly. Because some of the stuff we're not able to do, it might have to go to the state. I doubt very much any of it would have to go to the feds.
Very little goes to the federal level. Most of it stays either at the local level, and we may take guidance from the state, which is not uncommon for health departments to do. Many of our codes and regulations are state codes and regulations that the Board of Health adopts and charges the health department to carry out.
Okay. That's good. That's good. And like I said, you know, I can talk on the drugs and what's going on, and
which is a huge portion.
Yeah, well, yeah. Right now it's in everybody's, you know, because most people aren't aware of the problem that we have. And it's not a major problem, but for us it is a major problem. When you have 1 or 2 deaths in a town this size, it's bad. When you have 23 overdoses, that's bad. And we have different products that we can get out. We have flyers that we have that we will get to everybody if they need be. And I'll bring in a couple of speakers during our talk on opiates and fentanyl, which is really now the really bad thing is the fentanyl that's being laced with all the different coke and heroin, and people aren't aware of it. So it gets to the point that I don't know. I honestly don't know how you try that, you know. And then once you get there, once you're hooked, it's a problem. It's a disease at this point.
I think it's important to know that people should know that you're one of the resources. You're one of the people that, if there's a problem, they can call you at the office.
Yes.
And we keep resources 24/7. If somebody needs to just step to town hall, go into the foyer, and we've got resource books available all the time. So if people need something, if they need a number to call, if they need some sort of help, there's a lot of material always available, which I know you keep readily stocked.
Yep. And we also have the terror bags, and we'll talk about that during the opioid thing. But if you have old or expired or extra opioids or any type of drugs like that, there's a bag now that you can put the drug in, put some water in, shake it up, seal it, then shake it up, and then you can just basically throw that away.
Now that bag operates by deactivating the actual active ingredient drug itself, correct?
Yes.
So that way when you throw that bag away in your trash, nobody can open that, nobody can get to it, and when it gets put to a solid waste facility, it is just thrown out, and the drug can't be leached back out into the environment as well.
And that's the good part. Save you the trip to the police department.
Well, I think there's a lot of information, Ray. I look forward to the show. I can't wait to be back on it. And when you decide what your order is, we'll make sure we send the right people up to bat.
I hope so. Thanks, Jeff.
Thank you.